everybody, I'm Dr. Diksha Pandey and you are watching, yes, Urogynecology for Beginners. Are you in for a Sunday class? It is a short surgical demonstration of McCall's Culdoplasty. And if you have yet not watched the earlier video on McCall's Culdoplasty, where I tried to explain the meaning of it and the goals of the same, please go and check it out and then come back here for a quick surgical demonstration. This is a step-by-step slow video to demonstrate to make you understand each and every step of the procedure. So there are two kinds of McCall's Culdoplasty, external and internal. No, these are not two different types. It's not like that you can say that for this patient I will do external McCall and for the other patient I will do internal McCall. No, these are one procedure, two parts of single procedure with different aims. The aim of internal McCall is to obliterate the pouch of Douglas so that the pressure of intra-abdominal content, which becomes more after removal of the uterus, does not cause an intracele or wall prolapse, posterior wall prolapse in the patient after the surgery. While the purpose of external McCall is of apical suspension. This is to hold the vaginal vault to the uterosacral ligaments so that the vault of the vagina is pulled up and fixed to the uterosacral ligament and thus actually to the sacrum, the sacral bone. So whenever you say that today you are going to perform a McCall's Culdoplasty, it is a combination of the two. With this short introduction, let's move ahead and watch the surgical video very slow, step by step. So come on in. So first internal McCall bite we take from the uterosacral ligament. This is the same uterosacral Meckenroth's complex which we have taken during vaginal hysterectomy as the first ligament complex. Then the suture passes through the preperitoneal pad of fat posteriorly. 3-4 bites you take from here. Take your needle out and then where you have to go, you have to search for the Meckenroth's uterosacral ligament complex on the other side. See it carefully, identify it and then take a bite. This is the first internal McCall suture. Don't tie the knot there because if you tie it, you will not be able to take your second and third sutures. For second McCall bite, again, go through the first uterosacral ligament, then take a few bites from the preperitoneal pad of fat that includes the peritoneum, high peritoneum, and come out. Now again from uterosacral Meckenroth's ligament complex, the last bite. This is second internal McCall suture. Keep it long, don't tie it now. For the third McCall suture, same thing again. Uterosacral Meckenroth's complex, bites high up in the peritoneum, higher than the previous two, multiple bites, superficial ones, and then come out from the uterosacral Meckenroth's complex again. So these are the three sutures which we have taken as a part of internal McCall suture. We will tie them at the end after taking the external McCall suture. So these are the three internal McCall sutures you can see which are pulled up now. Now we start to take the external McCall suture. For that we have to include the posterior vagina. And posterior vagina, the redundant portion has been already cut in a wedge shape. So you can see the vagina is not very long here. Take the bite from outside of the vagina to inside. That means the suture starts from the lumen. Then take a bite from the McCall's uterosacral ligament complex again. If your suture gets entangled, be careful and correct it then and there. Again, a few bites from the high peritoneum. And after that, you have to go again to the ligament complex. Then finally, come out through the vagina. Take a bite from inside to outside this time, so that the knot, when you tie, that will lie in the lumen of the vagina. Let us once again revise external McCall. The suture goes through the posterior vagina to the uterosacral ligament, multiple bites through the peritoneum, high peritoneum, comes out from the uterosacral of the other side, and finally through the vagina. Now you leave the external McCall and start tying the internal McCall sutures from below upwards. So the first suture you have taken should be tied first, followed by second and third suture respectively. Once all these internal McCall sutures, which are actually proline sutures, non-absorbable proline sutures, have been tied, you can feel the nice shelf which it makes to obliterate the pouch of Douglas. It will not only obliterate but prevent further enterocele formation also, thus preventing wall prolapse. It is a nice tight shelf. Now what we are doing, two sutures which we have left attached to the uterosacral McCall's complex in the beginning while we were doing hysterectomy, we had tied one suture in the midline from that, and the other remaining suture we are taking out from the vaginal vault a bit anteriorly. This will prevent vault prolapse, yes, and recurrence of cystocele also. So we have to thread it in a Mayo's needle and then take it out through the vagina at a high level. This is also known as low uterosacral ligament suspension. It is a technique to suspend the vault so that the vagina remains long and the chance of vault prolapse further decreases. Here we are doing it to support the cystocele as we are going anteriorly. This picture summarizes with a line diagram what we have done till now. So we have taken internal McCalls as well as external McCalls. Internal McCall sutures don't come out of the vagina. They remain inside. They are taken with proline 20 suture, and they pass from one side of uterosacral ligament, multiple bites in the peritoneum, and then come out from the other side of uterosacral ligament. In this picture, there are two internal McCall rows are shown. In our patient, we have taken 3. It depends. Whatever available space you have to obliterate that. So 2 or 3 sutures are usually taken for internal McCall. For the external McCall, we take a bite from the outside of the vagina, then go into the uterosacral McCall's complex, take multiple bites again from the peritoneum, come out from the uterosacral of the other side, and then finally come out of the vagina. The McCall external McCall suture is tied at the end after you have even closed the vaginal vault. And this is how it looks after completion of McCall. Perineuraphy was also done for this lady, which further adds on to 2 centimeters of vaginal length. That's all for today. Thank you.